Good evening. My name is Suzanne Seplow, and I serve as the Assistant Vice Chancellor for Student Development and Health in Student Affairs. I'm really appreciative for everyone who has joined us today and for the many questions that you have submitted ahead of time. Please know that this town hall is being recorded. Before we begin our discussion, we're pleased to have UCLA's Chancellor, Chancellor Jean Block, with us to offer a few remarks. Chancellor Block has been helping UCLA navigate the many challenges of this pandemic over the past year, and we're grateful for his leadership. Please welcome Chancellor Block.
Thank you, Suzanne, and welcome to all of our students. And I should say, I continue to be grateful for your resilience and the Bruin spirit in tough times. This has been a hard year for all of us, and I know it's been tough for you. You know, I truly believe we are beginning to see the light at the end of this very long tunnel. You know, I'm mostly excited by the fact that, we now have vaccines and the mass COVID-19 vaccination will be essential. It's ongoing, but it'll be essential to pulling our world out of this pandemic. So that's really one of the important factors. And vaccination clearly is going to provide the quickest path to bringing Bruins back to the UCLA campus for in-person instruction, hopefully this fall. But vaccinations are going to be key to achieving herd immunity and allowing us to operate in a safe environment. So to do our part, UCLA is committed to offering an FDA-approved vaccine to every eligible student, staff, and faculty member in our community at no cost. This is obviously an important public mission and our commitment to the community. But I should mention, if you qualify to receive a vaccine elsewhere, first, I encourage you to get it. If you live out of state or you live in another county, UCLA must abide by the vaccine distribution schedule set by our county, and you may be able to get a vaccine sooner through another provider, especially if you, as I mentioned, if you live outside of LA. So if you get an opportunity to get a vaccination, your vaccinations before, I would encourage that. So I know that there are some in our community who have concerns about the safety and efficacy of the COVID-19 vaccines. They're new, we recognize that. But both the vaccines currently approved by the FDA have undergone rigorous clinical trials that included people of all racial and ethnic backgrounds. So they have been tested rather thoroughly. I join the experts at UCLA Health and those you'll hear from today in my belief that the benefits of receiving a vaccine to you, your family, and to our whole community far outweigh any risks. When it's my turn to receive a vaccine, and I'm still waiting, I'll do that without any hesitation at all. And I hope you'll do the same when it becomes available to you. So while vaccines hold great promise, as has been pointed out by many, in the middle of this crisis, they're just part of the solution. We have to continue wearing masks, avoiding gatherings, washing your hands. All of these are all part of the armamentarium we have to fight this virus, and we have to be mindful of all these other protective procedures. So as I said before, I remain eternally grateful and proud to all of our students for meeting the challenges of this pandemic. I hope this town hall is engaging. I'm sure it will, and I'm sure it'll be illuminating. Please stay safe, and I can't wait to see you soon. We'll all look forward to getting together again in Pauley or other places on campus. Take care.
Thank you so much, Chancellor Block, for being here and for starting us off on this COVID vaccine-related town hall that has been specifically designed for our graduate and undergraduate students. We've assembled a panel of 4 leaders amongst UCLA who have been working tirelessly on the efforts around COVID-19 and understanding kind of how the vaccine will roll out and just information about the vaccine in general. And so what we're going to do is we're going to ask each of our panelists to share a short, brief presentation with you that will answer hopefully a lot of the questions, and that will then, however, after they each share in terms of the presentation, we will have Q&A. Many of you have already submitted questions, and we have worked hard to try to incorporate a lot of those questions into the 4 presentations. However, there is the option to still submit questions, and so feel free to submit questions. We will answer as many questions that we can, both questions that came in prior to the town hall this evening, but also questions that continue to come in throughout the presentation. We will then, after tonight, go through all of the questions. And in the near future, Ash will be putting up a website on FAQ specific around the vaccine, where we will do our best to answer as many questions as we can through that FAQ. So without further ado, I'd like to invite our first panelist, John Bollard, our interim co-executive director for the Ash Student Health Center, to kick us off. Welcome, John. Thank you.
Thank you so much, Dr. Seplow, and thank you all for joining us tonight. My role, before my colleagues start talking about the vaccine in detail, is to paint a little bit of a picture about where we are in Los Angeles County and on campus in terms of the pandemic and in terms of the campus's efforts to try and slow the spread of that pandemic. So I'm going to walk through a little bit of a slideshow here. If we could start with next slide, please. Thank you. So what this slide shows is Los Angeles County. And through this past Friday, there have been over 1 million cases of COVID in the county. And this, I know these are a little bit difficult to see, and I apologize for that, but the slide on the left shows the deaths per day due to COVID. And the slide on the right talks about positivity in Los Angeles County, positivity rates, which is the percentage of those who test whose results are positive. And as you can see, and as you know, paying attention to the news, we've seen just dramatic increases in deaths, in positivity rates, in hospitalizations in Los Angeles County. This started in December, have continued to increase. And just now you can see on both of these that we're hopefully heading in the right direction now in a downhill direction. The current positivity rate, which was above 20% in Los Angeles County, is now down around 14%, maybe even lower today. Next slide, please. This chart shows the positivity rate. The red is Los Angeles County, the gold is the state of California, and UCLA is the blue line at the bottom. This goes back to the beginning of November and shows our positivity rate. Again, the percentage of those who test whose results are positive. And you can see that everybody was really around and under 5% in November. But as December went on, and Los Angeles County really drives the state of California because of the population, just saw these increases pretty significantly. And then again, now starting to ebb. But if you look at that bottom line, which is UCLA, since we started testing robustly in the end of September, has had a positivity rate at or below 1%. That 2 weeks ago, we started to see greater activity on campus. 2 weeks ago, we had 350 people test positive on campus for COVID, and our positivity rate went up to 2%. Thankfully, this past week, we are mirroring what's happening in LA County, and our positivity rate went back down below 1%. Next slide, please. This just shows the total number of confirmed cases at UCLA. It does not include the health system. And you can see we've had 2,068 positive cases in our campus community that we're aware of. And it shows you by population kind of where those cases have been. A large number clearly are on people living in off-campus housing. We're so grateful that those folks are testing. And so we appreciate and encourage them to continue. And I'll say a little bit more about testing in a minute. Next slide, please. This final chart just shows the new cases by day, and it goes back to November. And the blue indicates faculty and staff, and the gold indicates student positivity. We were down around 20 cases a day in early November. That increased in November and December, and then we had the break. When we came back, we saw significant increases, again mirroring what was happening in Los Angeles County, up until this past week when we're starting to see a little bit of a decline. The other interesting thing is how many students compared to faculty and staff these past couple of weeks have been testing positive. Next slide, please. So what I want to talk just a little bit about is what the university is doing. in terms of its strategy to slow the spread of the disease. Because before we can talk about vaccine, which is here, almost here on the horizon, we still have a lot of work to do. The university is putting a lot of time, effort, and resources into these 4 things that you see on your screen, but they're built on a foundation, as Chancellor Block said, of regular wearing of masks and face coverings, of appropriate distancing, and of good hygiene. Those things are the foundation of any attempt to slow the spread. But these 4 pieces really make up our strategy for slowing the spread. And they start with symptom monitoring. Those of you who are coming to campus regularly know that you're required to do a survey that asks about symptoms, asks about tests, asks whether you've been exposed to anybody who's positive. And if you, depending upon your answers, you're either cleared to come to campus or you're not. And if you're not, you're directed to call the hotline. Hotline's going to direct you to test. So now we have this really robust testing program. I'll go into this a little bit on one of the next slides, but we are now testing 3,000 to 5,000 students, faculty, and staff on campus every day in multiple locations. What this kind of a testing program allows us to do, because we know that more than 40% of transmissions are coming from people with no symptoms. This kind of testing allows us to pull people out of the community who test positive, having no sense that they could be positive. We quickly put them into isolation and do contact tracing, which in itself really slows the spread of the disease. As soon as we hear that from the lab that there's a positive test, we have 15 people who do nothing but contact tracing right now. They're really well trained and do this job well. We're really proud of the exposure management team that does this. So that what they will do is they will call somebody who's tested positive. They will make sure they have what they need about isolation and see if they need anything or if there's anything the team can do for them. And they also ask them about close contacts, people they've been in close connection with in the 2 days prior to testing. Those folks who tested positive are then kept in isolation, taken care of, given opportunities to isolate on campus if they don't have those opportunities at home. Then we call their close contacts. We invite them in to test. We place them in quarantine or isolation depending on symptoms. If one of them tests positive, the whole process starts up again. And you can see how by paying attention to this and really focusing on it, pulling people out of the population as soon as they test positive, isolating them, checking who they've been close to, all of that, I think, has helped a lot in slowing the spread of the disease on campus and has helped us keep that positivity rate as low as it has been. Next slide, please. Very briefly, the testing on campus. Those of you who are living, working, or learning on campus or living in the surrounding community know that there are opportunities and even requirements for testing on campus. Since we started testing, we've done over 150,000 COVID tests. The vast majority of those have been since late September. You could test at 3 different locations on campus: in College Court at the Wooden Center, up on the hill at the Covell Grand Ballroom, and then at a tent that we've put up in Switzer Plaza in South Campus. We also have a bus, the mobile testing clinic, that we're excited about. It goes out and parks at apartment buildings around UCLA, where we know a lot of UCLA students live. We're targeting especially graduate students, but any faculty, staff, or student can test at that bus. Those who live, learn, or work on campus are currently required to test twice per week, given what's going on in Los Angeles County. We're evaluating all that all the time, and campus leaders will be making a decision as to when we will revert back to 1 time per week. Graduate students in university housing who do not come to campus are required to test only every other week, although for all populations, we encourage testing. Last slide, please. So my colleagues are going to talk a lot about vaccines, and we know that's why you're here. But as we wait for that herd immunity and we have these months ahead, I would just remind everybody to mask, distance, and disinfect. It is so important now to continue to do that, to test as often as you can, to follow the guidelines of the university for your testing requirements. It is helping us so much to do this testing. And then not letting our guard down now. It's easy to see those vaccines and start thinking about what life's going to be like when we get back to normal, but this is the time for us to focus and to continue. And we think, if we continue to do all of these things, and we're so grateful for you that you have been doing these things, we're going to continue to keep UCLA's positivity rate low. Thank you so much.
I was just demonstrating masking all the time. Thank you, John, for that information. Really, really helpful. Next, we're really pleased to have Dr. Edith Flores, one of our primary care physicians from the Ash Student Health Center. Welcome, Edith.
Hi. I am Dr. Flores, and I work at Ash Student Health, and I'm here to talk about vaccines. Okay, there's my first slide. Okay, next slide, please. So there are 2 new vaccines that are currently available, and they employ a new technology that's not been used before in the general population. I'm sure you've heard of Pfizer and Moderna. Those are the 2. They both require 2 doses and essentially are authorized for adults, with Pfizer authorized from 16 and above, and the Moderna for 18 and above. Next slide, please. So how do they work? So this is the mechanism of action made ridiculously simple. So if you look on the left, there's the spike protein, which is the little red doohickey that you see on all of these images. They are what get into the cell and cause the cell to reproduce more coronavirus. So basically, messenger RNA is like a blueprint. It's a recipe. And so this messenger RNA is injected into the arm, and it essentially tells the cell, hey, make some spike protein. And the cell says, sure. And then it does. It makes the spike protein. And then the immune system looks at that and says, hey, wait a minute, this doesn't belong here, and produces antibodies. And then in the future, if you're exposed to coronavirus, your body is already primed to neutralize that infection. And that's basically how it works. Next slide, please. So side effects of the coronavirus. You can have local effects, which basically are at the site of injection, and systemic, which are away from the site of injection. The local events are pain on the arm, redness or swelling. Sometimes you can get inflamed lymph nodes. Systemic events look like a flu, where you can have fever, chills, muscle aches, joint aches, and headache and fatigue. Next slide, please. So the point of this slide is to show that these side effects are measured in terms of severity. So grade 5 is fatal. That's a bad one. Grade 4 requires hospitalization, and none of the trials were there a grade 4 or grade 5 side effect. Grade 3 basically interferes with your ability to do basic things. So in other words, feeling so fatigued that you can't get out of bed, for example. Grade 2 is bothersome and may interfere with some activities, and grade 1 is mild and not bothersome. And the point of this slide is to show that the great majority of people who do develop side effects from the vaccine are grade 1 and grade 2. Next slide, please. Okay, so allergic reactions. When Pfizer was authorized, on day 1, there was a black box warning saying that if you have an allergy, if you have severe allergies, you shouldn't get the vaccine. Fortunately, allergic reactions are rare. In Pfizer, they're seen in 0.63%, and in Moderna, 1.5%. Next slide, please. So these recommendations have been fleshed out a little bit more. So I consider this the yes, no, maybe so in terms of allergies and getting these vaccines. So if you have allergies to oral medications, allergies to pets, food, egg allergies, etc., bee sting, etc., you can get these. If you have a family history of allergies, you can get these vaccines safely. If you have an allergic reaction to a messenger RNA vaccine, which now just basically means Moderna or Pfizer, that's a hard no, that you should not get you should not get this vaccine. And the maybe so are people who are allergic to, have had an allergy to vaccine or injectable therapy. And in that case, basically you have to do a risk management. If somebody is at high risk for severe disease, they should be sent to a specialist where they would vaccinate them under controlled conditions if that's the decision that's made. Next slide, please. So you'll hear that these vaccines are 95% efficacy for Pfizer, 94.1 for Moderna. And what does that mean? And what doesn't it mean? So with respect to Pfizer, for example, they had over 40,000 people, and half of them got the vaccine, half of them didn't. And then what they did was, as people became ill, they checked to see if they tested positive for coronavirus. And when they got 170 people who tested positive, and then they looked to see how many of those were vaccinated and how many of those weren't. And it turns out that of the 170, 162 had not received the vaccine, and only 8 had received the vaccine. So what does it mean? It means that it works really well, okay? But if the goal is to decrease the cases of coronavirus, it's not enough. First of all, if people don't get vaccinated, it doesn't matter how good your vaccine is. And it's guesstimated that in terms of reaching herd immunity, about 75 to 85% of the population would need to be vaccinated. And that also takes time. You're not going to vaccinate 3/4 of the population in 3 weeks. And so because of that, or partly because of that, masks, social distancing, hand washing, and et cetera, must continue. Next slide, please. I just wanted to say, this is the safety aspect of this. I just wanted to say that emergency use authorization is only granted during a declared emergency. And known and potential benefits have to outweigh the known and potential risks for a drug or a vaccine to receive emergency use authorization. And also vaccine candidates must reduce infection by 50%. And so these 2 vaccines really blew by that milestone. Next slide, please. There's also concern about the vaccine being rushed. So was it rushed? Yes and no. So this is kind of the vaccine life cycle. And basically, if you look on the left-hand side, that orange section is the research and development, animal studies, et cetera. The messenger RNA viruses have been studied since the 90s. So this is a new type of technology for a vaccine, but it's not like it just started in March. There have been trials actually for Zika, CMV, and rabies. And if you look in the middle where the green area is, this is where human trials take place. And basically, these trials look at safety, efficacy, dosage, and to see whether this actually works. All of these steps were done. Some of these steps were done in parallel. So you had phase 1 and phase 2 happening at the same time, phase 2 and phase 3. So they were able to do this more quickly in that way. But these vaccines that receive emergency use authorizations are held to the same standard as any other vaccine. Anyway, as any other vaccine. So next slide, please. So concerns: who should get vaccinated? If you're pregnant, should you get vaccinated? And the answer is yes. Pregnancy increases the risk for coronavirus complications, and it also increases the risk of pregnancy complications. If you've already had COVID-19, should you get vaccinated? Yes, it's unclear. Well, actually, it's not. You can get it again. It's rare, but people have been infected more than once. And also, immunity is not forever. You should not, though, get vaccinated while you're in isolation for COVID-19. So you should be out of isolation. And also, if you feel like the survival rate is high and that you're at low risk for disease, the survival rate is high, but young people have died from this disease who have had no risk factors. And even if you're at low risk for severe disease, you can still pass it on to others who are not at low risk for severe disease. So that's another reason why everyone should get vaccinated. Next slide, please. So Vaccinated persons should continue to follow all current guidance to protect themselves and others. So there is some things that are just not known, or there's limited data. So for example, how much the vaccine reduces transmission in the general population, how long the vaccine mediated immunity will last, how effective it is against asymptomatic spread. These are things that have not been answered, And so again, continuing the social distancing, masks, etc., should still be followed. If you, according to the CDC, even if you are vaccinated and you're exposed to someone with coronavirus, you should quarantine as well. Next slide. So this slide is just to say that vaccines are our friends, and they're an important part of the fight against COVID. This is a graphic representation of pre and post vaccination programs for the diseases that you see listed in the middle. And this is back from 2007. And so again, vaccines are among the greatest achievements of medical science and public health. They really are our friends. And that's it.
Thank you, Dr. Flores, for that information, and really important in terms of understanding the vaccine and how it's been developed and how it works. So truly appreciate that information. Next, I'm really pleased to welcome Bill Dunn. Bill is our Administrative Director for Emergency Preparedness, Security, and Safety at UCLA Health, and has been a true leader for the campus as it relates to COVID-19. So thank you, Bill, for being here, and take it away.
Thanks, Dr. Seplow, and thanks everyone for attending this evening. Hopefully we'll go through this presentation and answer many of your questions. So a lot of people are very interested in the vaccine, and the most common question people have is, when will I get it? So the answer is when we can get it to you as quickly as possible. Because production is taking time to ramp up, we don't have availability or allocations to offer it to everybody immediately. We hope that in coming months that will be the case. But the federal government, as well as state government and county government, has initiated guidance to look at allocation of this as a scarce resource. So you may have heard in the news media regarding tiering for these allocations. So this first slide here shows this phase 1 tier as we're ramping up production and the utility for this opportunity to really take a look at how do we allocate these scarce resources. So in this first group, again, we're going to try and provide this from an equitable fashion. And really the equity looks at those that might be impacted the most from a severe engagement of the disease. So the elderly population or those with significant underlying medical conditions. Also those involved in components of society like healthcare that without those individuals, without those people being healthy, that we wouldn't be able to sustain moving forward with appropriate treatment and healthcare. Many other sectors, critical infrastructure sectors, including education, are also identified as we move forward in some of these high risk priorities. So in the state of California, you can see here that there is a model in phase 1 that really looks at the allocation during scarce resources. So this first phase here, phase 1A, we're just about through in Los Angeles County. This included healthcare workers as well as long-term care facility residents. So skilled nursing facilities, settings like assisted living, where those individuals, we've had significant outbreaks in those settings. And that's where we've seen a vast majority of the fatalities, not only in Los Angeles, but really across the country. The second tier we've just started getting into. We got permission last week on Wednesday from the state to move into this first phase called 1B or 1B1, and only a portion of this particular phase. So it was opened up last week to individuals that were above the age of 65 years of age. So right now, those are the only individuals across the state of California that are allowed to receive receive the vaccine as part of our allocation strategy in this, again, limited resource. The next areas that'll be opened up in 1B1, however, include a big portion of our campus. So this includes the education sector and childcare, So as we move into that, we will open it up for many more employees and faculty and staff and students that are employed by the university as part of this allocation. Further tiers, as we move again and we have more production and more availability of the vaccine, and we complete some of these earlier tiers, we'll move into tier 1B2, which will include more critical infrastructure areas, as well as congregate settings. Now, again, there's a few questions regarding congregate settings. It doesn't mean sorority and fraternity houses, and it doesn't mean areas of on-campus housing. Really refers to prisons and homeless shelters where, again, people are in confined areas and don't have opportunities to really segregate. Then we'll move into 1C, individuals that are 50 to 64 years of age, again, just strictly based on age grouping. And then individuals from 16 to 49 that have underlying comorbid conditions or underlying medical conditions that would leave them more vulnerable to the the COVID disease process, as well as additional sectors. Once we get to 1C, then it will open up to hopefully larger production and open up to larger blocks of our society. So far, what have we done at UCLA? So we have worked through our 1A group. So we initially have offered about 35,000 to 37,000 individuals from our health sciences areas that have components of direct patient care or are doing research related to healthcare and in close quarters. So these individuals, as well as our campus partners that support directly the hospital or health system to sustain healthcare, have been offered the vaccine. We also opened up last week, as I mentioned on Wednesday, as the state moved forward into 1B1 tier, any UCLA personnel and students over the age of 65. So we've started inviting individuals in this group to move forward with the vaccination process. We identified a little over 5,300 individuals that were in this age bracket. We invited initially as part of the health sciences group a little over 2,700, and we've now invited, as of this afternoon, we'll have invited, hopefully by the end of today, we'll have offered a little over 65% of those individuals the opportunity to be vaccinated. So again, we risk stratify this based on age and also social vulnerability index. So individuals that live in parts of our community that have less access to healthcare or might be more vulnerable. So our current status, again, we've offered vaccination to almost 36,000 individuals. We have about 24,000 that have received dose 1 and almost 8,900 that have received dose 2 and completed their vaccination series at this point. So again, we're trying to move quickly, started this in December 16th, and again, trying to move quickly with the vaccine that were allocated. So again, we've offered this also to UCLA patients that are over the age of 65, started last Wednesday. We've invited about 18,000 individuals. We vaccinated over 2,000 of our most at-risk population and our patient population. But we have about 100,000 UCLA patients that fit into that tier. So we're trying to move through as quickly again as we can based on the allocation that we're given each week. Moving forward, we've also been asked to help support the broader community. So in Los Angeles County, for those healthcare workers that are not affiliated with acute care hospitals, we were asked to assist, and also again, that broader population over the age of 65. So we've opened some of our vaccination hubs and appointments to be able to support that. And again, through this last week, we vaccinated another 2,200 individuals to really support our broader community. So our next steps at UCLA. So as soon as we can move into that next phase of 1B1, into that education sector, we're going to open up that more broadly to our campus community. So we are waiting on some specific job titles and areas from the state of California and County of Los Angeles. But in general, those individuals that are part of the educational sector, that participate in education, that help us move forward to provide education, our educational mission would be included in that process. So we don't have an immediate timeline. Again, there are significant numbers of individuals that are in that over 65 age group in the state of California and locally in Los Angeles. So we need to get through a significant amount of that population before we can move into this next phase. In the 1B2, again, looking forward into congregate settings and additional essential sectors, and then 1C, again, individuals that are 50 to 64 years of age, and then those individuals 16 to 49 that may have underlying conditions. So when we talk about the student population, this is where we will likely get into more students. If they're not employees of the university, they're not in higher risk job functions, then likely majority of our students will fall either into this 1C area or beyond into the 2A or further down into that prioritization list. So for students that again are between 50 and 64, or those that have significant underlying medical conditions, this is when they would be offered that particular vaccination opportunity. So just some assumptions is that we're going to vaccinate all of our campus essential employees as part of the UCLA health system. Staff involved in patient care, many of them have already been offered across the campus in the 1A group through UCLA Health. And if they're not, they should be among the first groups to be vaccinated in 1B. So as we move forward, we'll be continuing to prioritize those groups. Employees with underlying health conditions that may put them at risk or advanced age, if they're offered prior to the 1B1, we certainly encourage them to get it as soon as they're offered. Employees working exclusively from home, unless they meet the age criteria, won't necessarily be eligible for vaccine as part of the 1B strategy. And we'll also prioritize those that need to be returned for on-site instruction as part of this grouping as well. So again, how have we prioritized this internally at UCLA? So as I mentioned, we've already started with this group of employees over the age of 65 and students over the age of 65. We'll be next moving in as soon as the county allows us and we have more dosage available into high contact, high location variability employees. So areas like residence life, housing, food service staff, or again, lots of contact with other individuals, as well as potentially higher risk based on their occupational risk factors. Custodial, ground, skilled trades, et cetera, moving forward. We'll also be looking to vaccinate our pre-K to 12 teachers and staff and childcare team that exist on campus, as well as research faculty and staff that are already approved for return of on-campus research, faculty teaching in-person courses, and faculty and staff working on site to support remote instruction. So again, we'll be moving through those to offer vaccine when that's available. We'll then move into other on-site employees, off-site educational essential employees that again are deemed critical to the mission of the university. And then again, students will fall into subsequent risk stratification tiers based on eligibility of age, pre-existing conditions, or otherwise. So one of the questions that came up was regarding how do we risk stratify further? So we're utilizing something called the Social Vulnerability Index, which is a CDC tool and has been helped and assisted through research right here at UCLA to identify individuals that may have less social equity or healthcare equity. So in certain populations that have less access to healthcare, have more housing challenges with multi-generational areas, or live in higher density of populations for housing, less access, again, to healthcare, more reliance on public transportation, and some racial and ethnic backgrounds that, again, traditionally have been shown to have less access to appropriate healthcare. So again, we're utilizing this really as a strategy to try and even the playing field when we have limited vaccine to offer those individuals that may have less healthcare equity first in our opportunities for vaccination. So again, this is only in a case where we have limited vaccinations available, and we have a larger group that's been identified in this particular tier. So caveats, again, we are going to offer this to all employees when we have the vaccines available and as we are allowed to move through in the state and county tier system. Employees may be offered a vaccine from UCLA First or their physician, or other agency in that process. And we recommend really that they go to wherever they're offered it first. But again, UCLA Health is also going to be vaccinating all of our patients. So if you are a UCLA Health patient, you may also see a similar invite if you are in one of those risk stratified groups. We are offering the vaccine at Ronald Reagan Medical Center here in Westwood, at our UCLA Medical Center in Santa Monica. And we have 3 sites open more remotely in Thousand Oaks, Calabasas, and our Torrance site will open next week. And we'll have a Santa Clarita site open the following week as well. So again, for those individuals that are currently off campus, but do meet the risk stratification tiering, could go to one of those areas as well as the Westwood Hospital as well. So just from a logistics perspective, we also would encourage everyone to participate in the online education. This is a University of California mandate. So there is a link to this outreach in both English and Spanish, but it really tries to provide people background and information on the vaccine. So much like you heard earlier in the presentation, really helps you identify what the benefits of the vaccine are, as well as the potential risks. And again, for most of our population, the benefits of the vaccine far exceed the risks of minor side effects or mild reactions to this particular vaccination. So again, in trying to be as transparent as possible, that education was developed. Employees will need a UCLA medical record. So in some cases, we're going to have to gather a little bit more demographic information. So we're in the process of doing that now. You'll get an email to initiate your appointment. So that will start the process. And then people will be able to go into the UCLA MyChart application or desktop interface and do self-scheduling of the appointment at one of our locations. After they receive the first dose, they'll have the immediate opportunity then to schedule their second dose at 21 days for the Pfizer vaccine or after 28 days for the Moderna vaccine. So again, with that application, you can go in and self-schedule at your convenience. Just a few other things. Again, as I mentioned, the education, it is online, so we'll send out the link to that. Really, all of the risk stratification is done based on risk for the disease and in catching the disease and having challenges with that, or having significant risk factors related to comorbid or underlying medical conditions that could negatively cause fatalities or significant illness related to this particular disease process. So again, more logistics to follow. So I'll turn it back over to Dr. Seplow.
Thank you, Bill, so much. And through those first 3 presentations, hopefully many of the questions that came in prior, as well as that are continuing to come in, have been answered. But please, please know that if you have a very specific question, whether it's about your role as a student employee, or whether it's about you as a student in the vaccine, you can reach out to your supervisor and or to ASH. Check out the ASH FAQs, and we will work hard to get these questions answered for you. As I said at the beginning, we have 4 panelists, and I'm very pleased and appreciative that Dr. D. St. Maurice, who is the Co-Chief Infection Prevention Officer at UCLA Health, has also joined us to help us answer the questions that you've submitted. So welcome, Dr. D. St. Maurice, and thank you for being here. And I will pass you the first question, which is, if we have received the vaccine outside the US, is it recommended that we receive it again when we come into the States?
Yeah, so that's a great question. If you have received the vaccine elsewhere at this time, we do not recommend that you receive the vaccine here. Same goes for if you received one manufacturer's vaccine here in the US, we do not recommend that you restart this series here. We will update our guidance as more information comes out from Public Health and CDC, but those are the recommendations at this time. No, another question that has come up as well is if you were vaccinated and received 1 dose at your hometown, should you receive the second dose there? And we would advise you to complete the series where you started it.
Extremely helpful. Thank you. The next question, which Bill and John, you've touched on, but just to continue clarity, what will be the prioritization of students to receive the vaccine, and any sense of where they will actually receive the vaccine?
Sure, thanks, Seppi. I can start an answer to that. The timing of it is not yet known because of the distribution. As Bill talked about, we don't know how soon these vaccines will be available and how soon we'll work through these various tiers. Some are thinking that vaccination for the broader population, which most students will fall into, will happen this summer. But again, it's so early to know that. We are working with the campus, and we're working in close collaboration with the health system to determine prioritization for students and to focus on those with some of these underlying health conditions. We'll be communicating with the students directly as you become eligible for vaccination if you're on or near campus. And we'll work very hard to make sure that communication is clear and easy to you, because we know people are very interested in this.
Thank you. Maybe another follow-up question for Dr. D. St. Maurice is, do we know if this vaccine will be yearly or a one-time administration? Well, you have to get 2 doses, but will you have to get it annually?
It's a great question. We don't know that at this time. I mean, there's great data demonstrating that at least for, a few months, the immune system responds and is protective against SARS-CoV-2. And we think that it will, at the very least, be protective for at least 6 months, probably 9 months. But how long beyond that from the vaccine is still is yet to be determined. But we anticipate it will be longer than just a few months.
Great, thank you. And now I will pitch this over to Dr. Flores, and that is, can you spread COVID to others after receiving the full vaccine dose?
So what the clinical trials tell us is that the individual is protected. And by the way, that's 95%, not 100%. So you could still get COVID with the vaccine. There's limited data on the effect on transmission. There's some suggestion that it does decrease the risk of transmission if you have been exposed, but that's just kind of not known yet.
Great. Okay, for the next question, I'm going to go to Bill and/or Dr. D. St. Maurice. If my roommate is priority for the vaccine, will I be able to get priority myself?
At this time, no. So we get this question a lot, especially regarding healthcare workers, some of our faculty and staff members, and even trainees that live with relatives at home, and whether they would be eligible for the vaccine. And at this point, again, unless they meet one of the criteria in those tiers, they wouldn't be eligible. So we do have to follow the guidance that's put out by the federal, state, and local government to make sure that from an equitable engagement, we're really trying to meet the needs of the community.
Very good, thank you. John, I'm going to pitch this over to you, and that is, will it cost me any out-of-pocket money to get the vaccine?
Right, great question. If you are getting the vaccine here at campus, the university is committed, as Chancellor Block said, to making sure you have full access to that with few obstacles. So there will be no out-of-pocket costs. And in fact, in this first wave of vaccination, the sense is that there will be no cost to people for this vaccine. A little bit of a caveat is, if you get it in other places, there may be a time when some of these folks are billing for the administration fees associated with the vaccine. So if you're a SHIP student and you're going to get your vaccine back at your own home, you want to talk to the ASH Center to get a referral in case that's required, to make sure you have no out-of-pocket costs for the vaccine.
Thank you. And continuing with you, John, can you also share, if I'm graduating in June, and I haven't yet gotten the vaccine, am I going to still be able to get the vaccine from UCLA?
Yes, absolutely. So anybody who's eligible, and we count students who have graduated up until the time that the next quarter starts, is being eligible to receive these services. And so we'll work closely with you about specific eligibility questions if you're getting it off campus, or if you are leaving the UCLA vicinity to get your vaccinations. But certainly you'll be covered post-graduation at UCLA for the summer months for eligibility.
Thank you. This one I think is going to Bill, but there have been many questions, particularly around our international students and out-of-state students, about when they will get the vaccine. Can you speak a little bit about that, a little bit more?
Sure. So as I mentioned, if individuals live out of the country or out of the state, and they're offered it, each state is handling the rollout a little bit differently. So if you are offered that, or you fall into a prioritization group for that particular jurisdiction, then we would encourage you to seek the vaccine as quickly as possible. Again, as I mentioned, we're really having to follow the state and local guidance. So while you may not fall into an immediate tier here in Los Angeles, you may have that opportunity again in another state, another location to get it sooner.
Very good. And John, I'm going to go back to you for a minute and just say, if I'm a student employee, inclusive of ASUCLA, can you remind me where that puts me on the priority?
Absolutely, yeah. So all employees of the university, including student employees, fall under 1B. So that, as Bill has been talking about before, 1B is the one that sort of is starting very soon with those over the age of 65. Below that then are these essential employees, including university employees. So that group, which will start in the next few weeks or after they get through the folks who are over 65, will include UCLA faculty, staff, and those students who have an employment relationship with the university, whether you're graduate or undergraduate students.
Great. And that is particularly the priority will be for those students that work on campus, or just student employment in general?
Yes, sorry, it will be for those, and most students who do work on campus, but this will be specifically for students who work on campus, and it will include ASUCLA student employees who are working on campus.
Great, thank you. The next question is, will the vaccine be mandatory for students? And will it be mandatory for me to live on campus, to go to class, to participate in events? And I'm going to pitch that to myself. So I'll try to answer that one. But right now, we don't know if the vaccine will be mandatory. As our students know, we do have immunization requirements for the campus. But at this point, it's uncertain whether the COVID vaccine will be required and mandatory. So plans are in place. We'll continue to work with local, state, CDC guidelines as it relates to next steps as it relates to next steps for the vaccine being required or mandated. So more to come on that. We will certainly communicate that out to students if it is the direction we go in terms of it being mandatory. The next question I'm going to pass to Dr. Flores, and that is, will campus COVID protocols, particularly around public health measures, change once I'm vaccinated?
No, that's an easy one. No, for the reasons mentioned in the presentation, there's no way that we're going to get to herd immunity right away. There are other issues regarding decreasing the risk of coronavirus. And so as a result, the vaccine, you'll get the vaccine, yay. Will anything change? No, we're still going to be doing, we're still going to be wearing masks, we're still going to be social distancing, etc. So that doesn't change anything. That's not to say that that's forever, but definitely for now, that's what it is.
Okay, thank you. We are about at our last 2 minutes, and so I'm going to ask one more question, and then we will kind of wrap this up. But sticking with immunity, there's a question in terms of, is there a difference between the immunity gotten from the COVID-19 infection from immunity received from the vaccine? Don't know if, yep, go
Sure.
ahead.
Happy to answer this. So when you have natural infection, your immune response might vary in part just due to the amount of virus that you're exposed to, how severe your symptoms are. And there are some vaccines that actually have better immunity when you receive the vaccine compared to when you have natural infection. And we think that's the case with the COVID-19 vaccine. Actually, we know that the vaccine protects you against the spike protein, and that is very protective. And there are data demonstrating that people who've received the vaccine are actually more protected against future infections than people who've had natural COVID infection. And that immunity might last longer. So we definitely recommend even people who've had COVID that they get the vaccine when they're no longer infectious and at some point.
Thank you. Well, at this point, we are out of time. I want to once again thank Bill and John, Dr. Flores and Dr. D. St. Maurice, and our Chancellor for being here tonight and for answering as many questions and providing a wealth of information around the COVID vaccine and next steps for the campus. We will continue to keep you posted. Please look out for two things. On the Student Affairs webpage, there is a student guidebook that we are updating continuously with key information about COVID, but also just about campus life. So please check that out. And then also continue to check out the ASH webpage as we continue to provide more FAQs to our students regarding your healthcare, your health services, and COVID in particular. Again, I thank you all for being here and being present. And please reach out to us if you have additional questions. So have a good night. Thank you, panelists. Thank you, Chancellor Block. And stay healthy, Bruins. Go strong, Bruins. Thank you.